Hi, I'm Dr. Joe Niamtu, LoveThatFace.com. If you follow our channel, you know that I do cosmetic facial surgery from here to here. I don't do boobs, bellies, and butts. We're in Richmond, Virginia, and facelift surgery is my passion, and eyelid surgery is my other passion. And we have an international practice, and we have over 20 million views on YouTube, so please like or subscribe or both. And today, this is going to be one of the most important videos I've done. And I want to tell you, one of my points today is to scare you. Now, I know that sounds really weird, but so many people do not take recovery serious enough in cosmetic surgery. Now, many of the things I'm going to tell you today, they would apply to any surgery. I just do head and neck surgery, but they would apply to abdominoplasty or breast surgery or whatever. But many of the things I'm going to talk about, and most of them are specific to head and neck surgery and certainly facelift surgery, okay? Now, listen, you may only do this once in your life. And you can have a great doctor, you can have perfect surgery, and if you have and you have Mother Nature goes your way, but if you have a non-compliant patient, it can ruin everything and cause serious problems, okay? So please listen to your doctor and listen to the things that I'm going to say. And many of my videos, a lot of other doctors use, which is a compliment, because it's really important that you understand these things about recovery, because you may only do these procedures once in your life, and if they go wrong, they can go very wrong. So the first thing, caregiver, all right? You cannot have a facelift and really shouldn't have any surgery for that matter and be on your own, just by yourself, especially with a facelift. And you need to have somebody there to help you with your medicines, to help you to the bathroom. If you did have some problem, help you with that. Now, I never read script. I'm a spontaneous person, but there's so many things that I don't want to forget. I'm going to read things. So we see, probably over 1,000 patients a year. And one of the biggest problems for us, or any doctor, is the solo patient who's hardy and they don't feel that they need help and they can do anything by themselves, and that's a red flag. And I got to admit, I'm probably a little bit that way as a patient, okay? Although this seems like a plus, somebody says, well, I'm going to fly to Virginia and I'm going to have a facelift with Dr. Joe, and you know what? I don't need a caregiver. Heck, I've done stuff before, and I just don't need that. And you know what? I'm going to stay 2-3 days and go back, okay? Hey, this is not a vacation. This isn't Disneyland, okay? If I do a facelift, I need you here at least a week. If you can go home early and you're doing great, that's fine, but you got to commit to it. And, a lot of people do 2 weeks, which is, recommend that, which was even better. But you need to have a caregiver, and you need to let us make the rules. Let your doctor make the rules, because the people that we see that have problems are the people that, they just didn't do the things they were supposed to. They didn't get their consents done on time. They didn't get their physical done on time. They didn't listen to us about a close hotel to stay. They didn't get a caregiver. So much of the stuff that happens can be a patient's fault, okay? And I have the greatest patients in the world, but this is important stuff, so stay with me. Okay, preoperatively, you have to understand all your medications and what to take. Now, depending on the procedure, you could have 4 or 5 medications: an antiviral, an antibiotic, pain medicine, steroid, scar creams, things like this. So we've taken a lot of time in my office to make little spreadsheets and videos so you know exactly what to take and when. And it's very disconcerting when a patient comes in and they've got their medicines all mixed up and they didn't take them, or they took the wrong ones. So again, this is not rocket science. Just make sure you understand what to take and you put them out there, or use a little one of those little pill holders, because that's very important too. Also, it's important to take your own prescriptions. So if you're on a blood pressure medicine or a diabetic medicine or something, and we'll talk to you all about that, but you bring your medicines with you, obviously. Now, when I do eyelid surgery, and especially facelift surgery, I want my patients to be a couch potato for the first 2 days, all right? Literally, I don't want them out of bed except to go to the bathroom, okay? And I've had experiences where people get a hematoma, and I'm going to show you a picture of a hematoma, and they're ugly, okay? And they're rare, in practice, but any doctor that does facelifts is going to see it. And you don't want to call my office or your surgeon's office in 2 in the morning and have something like this happen. When it happens, it's almost always a non-compliant patient. We've had patients that are staying at a local hotel, because about 50% of my facelift patients are from out of town, so we always have several people here every week in local hotels close to our office. And we've had people that went to the gym. I had one patient that had a facelift and that night walked over the mall at Applebee's and ate dinner. I had another patient here recently that came back with some bleeding because they went down and walked around the hotel and the grounds of the hotel. You can't do this. You just had surgery. And sometimes you feel real good, all right? And you feel like doing stuff. Don't do it. Stay in bed. Be a couch potato. Trust me on this. It's not fun if you have a hematoma or a related problem and you have to come back to the office in the middle of the night. You don't want to be that person. All right, a good night's sleep. So one of the things about having any kind of surgery is sometimes it's very difficult to sleep. For years, we told our patients that they have to sleep sitting up, propped up in a propped up position, so the blood doesn't, more blood doesn't flow to the head. And I've really evolved on that, as many of my colleagues. I just tell people to, if they can sleep on 2 pillows, that's great, and just try and sleep best you can. This is a great time to use a sleep aid, all right? And, we can prescribe that for you, but sleep is very important, as is nutrition, which is our next topic. Now, I think it's really great to get prenatal vitamins. You can get them online or at your local drugstore, and obviously you're not having a baby, but these have just about everything you need, and they have they're iron rich as well, and it's just good if you're not on a multivitamin already. Take prenatal vitamins, kind of start that a month before your surgery. Boost, which probably most people are familiar with, it's a protein type drink you can get at any drugstore or online. And these are really good because they're not particulate, they're low sodium, they're high in protein, and it's a good post-operative drink, and you can drink 5 or 6 of those a day, okay? And because we don't want people chewing, we don't want them biting into hard things, which we'll get into a little bit more of that. A low sodium diet, that's important too. You eat a lot of salt, you're going to get more swelling. And we like patients to be on stool softeners if they're going to be taking pain medicines, narcotic pain medicines, because those will constipate you. And if you're constipated and you're straining with bowel movements, you increase your blood pressure and you can bleed. You can have hematoma of your facelift, you can bleed into your eye. So any situation like that, you want to prevent. All right? Now, let's move on with those kind of things to do. Let's talk about things not to do. And I've already stressed so much the activity for 48 hours. And we've had patients, and males are the worst, okay? So I had one guy came in, and he was all swollen the day after his surgery, and said, well, what do you, well, gosh, this is unusual. And he says, well, I've got a week off, so I'm going to sheetrock my garage. So I cleaned everything out last night. Oh, please, come on, use your head. You got to rest, all right? You got to rest. Driving. So if I do a facelift, if anybody does a facelift, you're going to be pretty stiff at first. If we do your eyelids, you're going to be swollen, you're going to have a little blurry vision. You don't want to drive, okay? You can't drive. You can't turn around. You might be taking pain medicine. So you have to have somebody drive for you until you can do that, which, is usually at least a week. So that's very important as well. Things you want to avoid. The next thing is you don't want to take anything that's going to affect your platelet function, in other words, make you bleed. And that includes aspirin, Advil, garlic, ginkgo, ginseng, which are called the 3 Gs. And that's very important, okay? Because if you bleed behind your eye, you can have serious problems. It's very rare, but it can happen with a non-compliant patient or a patient that doesn't follow rules. And the same thing with a facelift, okay? And, it can not only affect your vision in a facelift, it can affect your whole result, all right? And you want to refrain from anything that's going to increase your blood pressure. So when you think about that, anything where you're bearing down, okay, where there's bending, lifting, coughing, sneezing, walking, clearing your throat. So a lot of times after anesthesia, people have an airway during anesthesia, and they kind of feel like they have a raspy throat, and they keep trying to clear it. Each time you do that, you're putting pressure. It's just like blowing up a balloon, and if that balloon pops, i.e. the blood vessel, you're going to bleed, okay? I'm always taken back when somebody asks me in the recovery room, you know, can they have sex tonight? All right, and more power to you, but no, all righty? So you got to pull the reins in here for, you know, you talk to your doctor about it, but again, anybody that we operate on, we don't want them to have increased blood pressure or be moving around or straining themselves for usually at least a week, okay? Hard, chewy foods, you want to be on a soft diet, okay? You don't want to eat anything crunchy. You want to limit your talking even, really. And, you know, I've had patients come here, and we just had a patient the other day. This person was on their cell phone from the time they got here to the time they left. Talk, calling all their friends. They're not working, they're out of town, you know, they're at a hotel, kind of stuck in a room there. And you don't want to do that. You want to rest. Each time you open and close your mouth, it's a pumping action, okay? So that's important. And no chewing gum as well. Pets, okay? Hey, we love our pets, and they're such a big part of our life. But they can carry MRSA, they can carry other infections, and especially like if you have laser resurfacing. But really, if you have any surgery where you have open wounds, you don't want your pets in your bed. So you're going to have to figure that out beforehand. And again, it's very frequent we have single pet owners, and they have to bend over and lift or pick up their dog or their cat or whatever, or go out and walk them. We have people with horses. They want to shovel manure the next day or bale hay. You can't do that. You have to take your time. Another thing is positional posture. So when we do a face and neck lift, you know, we have all this skin dissected and put back together, and you don't want to be in a position like this where you're looking down at your phone or your computer or your tablet. If you're going to be doing that, you want to be looking this way. Otherwise, what can happen when you bend over like that, you can get your skin folds over and you can get little rolls of clotted blood, which can become fibrous, and we call that tech neck, all right, or I call it that. And so you just want to kind of stay in an upright position. You don't want to like fall asleep in this position. And some people, you know, if they're prone to be in that position, you can wrap a towel around you and put a piece of tape around it so you can't move. And then I think finally, one of the things that doctors, and this applies to just any doctor, is when a patient has a procedure and they call you 3 days later or 5 days later and say it doesn't look right or it's uneven or you know, I don't like this or I don't like that or I'm swollen. Come on, put down that 10x makeup mirror, okay? Really, if I could take the mirrors out of all my patients' house for 6 weeks, everything would be easier. And listen, we are very, very, very specific about your healing and watching. And if we see anything wrong, we're going to let you know. Now, I always tell my patients, they have my cell phone. Call me 24/7 if you have a problem. But you can't worry about your result, okay, unless something, is grossly wrong, which is really, really rare. So you got to give it time to heal. I don't take my after pictures for a minimum of 12 weeks. And so usually, you're going to be beat up when you do surgery to a certain extent. At 2 weeks, you'll see a difference. At 6 weeks, you see a big difference. And you can see subtle differences out even up to a year, all right? So, I've always said, if you can't call your doctor, then you pick the wrong doctor. So we have an open door policy here. I have a great staff, and we're in touch with our patients. So I don't want to run on anymore. I hope you get the idea, and you got to stay a little bit scared, because I'm telling you, you as the patient have so much to do with your result, your final result, and your recovery. So thank you so much. Stay scared. I'm Dr. Joe Niamtu, LoveThatFace.com.